We are not talking about something new. We are talking about something 400 years BC. We are talking about the medical lab when it was started during the Hippocrates, when he was examining the urine, stool, and blood. And that was the started of the medical lab. And during the 17th and 19th century, the real born of the medical lab was started. This is the timeline for the history of medical laboratory testing, where the ancient era started examining the urine, and then the time where they invented the microscope. Then in 19th century, the germ theory was introduced, and the microbiology labs was introduced. And in the early 20th century, where the automated labs started, and late 20th century, where the molecular and genetics were introduced. And thanks to the technology, today we are living in the era of the artificial intelligence. So when we talk about the old medicine, where the surgery were conducted, a surgeon is conducting a surgery surrounded by resident and fellow, and during the pandemic where beds next to beds, patients next to patients, and all patients and operations need the medical lab all along the way to the most advanced and complicated labs and automated and cutting-edge technology. Today, we are talking about the very advanced new era of medicine. We are talking about gene therapy, about gene editing, about CRISPR-Cas9. We are talking about immunotherapy in cancer. We are talking about genomic and precision medicine. We are talking about microRNA vaccine technology. And we are talking about regenerative medicine and stem cells. And all these disciplines need the artificial intelligence. So let's talk a little bit about the lab. And when we talk about labs, then we have different types of labs. We have clinical chemistry, we have hematology, we have microbiology, and we have molecular diagnostic labs, we have immunotherapy labs, and we have point-of-care labs. And the role of medical labs is for disease diagnosis, screening and prevention, monitoring different types of treatment, supporting precision medicine, and normally in a small labs, 1,000 to 2,000 tests per day. And in some large hospitals, they reach up to 20,000 tests per day. This is to show you the volume of the tests per day. Not only that, but the most important is that up to 70% of the decision is made based on the clinical labs results. Today, we are shifting from volume-based into value-based. However, there are some challenges that we are facing: human error, high workload, delayed turnaround time, complex data, and increasing test volume, complexity of big data. All these challenges put the AI as an important tool to be used to facilitate our work in the lab. Therefore, the AI is no longer a co-pilot. Today, the AI become an important tool, a partner that enhances accuracy, speed, and predictive capabilities. With that, now I can talk about artificial intelligence integration in medical lab. The artificial intelligence is transforming healthcare system globally as well as here in Saudi Arabia. The high demand for accuracy, speed, cost effectiveness, and automation of routine tasks, data-driven decision support, all these present the AI as an important tool. And today, we have no option other than to use the AI. So since early morning, we are hearing AI, AI, AI. So what is artificial intelligence in the medical lab? So artificial intelligence in medical lab refers to the use of advanced computational algorithm to analyze lab data, automate process, and support accurate clinical decision making. So it's faster, it's easier, it could be implemented. And there are two types of AI. The narrow AI, which can design to specific tasks, and the general AI that can simulate the human and make decisions that human can do. AI today, along with the machine learning, can be used as a predictive analytical tool for diagnosis, as well as can be used as a pattern for recognition algorithm. Today, the AI being used in several labs, being used in clinical chemistry, automated analysis with the AI-based calibration, detection of abnormal pattern, quality control optimization, and early detection of metabolic disorders. Moreover, the AI has been used in hematology, automated blood cell classification, morphological analysis, as well as can read images. The AI today being used in microbiology, and in the near future, a full microbiology lab will be introduced using the AI. The AI being used in digital pathology, in quality control, as well as in molecular diagnostic and genetics. And since I'm talking about genetics, this is an example how easy the AI can be used. This is a website that I created, platform, using the AI, and it took from me less than a minute. I used the Google Studio, and I put the information, and in less than a minute, this website being created. Not only that, the artificial today can enhance the drug development and clinical trial. Today, the artificial intelligence being implemented as a successful examples in cancer treatment, in cardiovascular diseases, as well as in genomic and precision medicine. Since I talked about precision medicine, now I could focus on the role of the AI in genomic medicine. The genomic medicine is one of the largest and major breakthrough in medicine in the century of 21st. And this program was established to support the healthcare profession through better diagnosis, therapy, and prevention. Here in Saudi Arabia, and due to the high rate of consanguinity, up to 60%, we have a loss of autosomal diseases such as vision loss, loss of vision, loss of hearing. We have cancer problems. We have newborn screening problems. Not only that, but nowadays we have seen cases that previously we never seen, including Cornelia-de-Lange syndrome, Brugada syndrome, Williams syndrome, Angelman syndrome, and therefore the clinical genome being introduced as a tool to help and support the health organizations and healthcare systems. And the clinical genome being used for disease diagnosis, cancer genomics, pharmacogenomics, prenatal as well as neonatal screening. And a single whole genome sequencing will produce a massive genetic data, up to 150 gigabyte. And from this 150 gigabyte, we have to go through all this process where we do bioinformatics for annotation, filtration, and then we have to move to variant and type identifying, interpretation, and clinical interpretation to reach to the right variant that associated with the disease. So it looks like a puzzle, and in this puzzle, you have to select the right variant that associated with the disease. And that is why we have a turnaround time up to 60 days with the possibility of human error. With that, the artificial intelligence being introduced to be used to facilitate the analysis and give the accurate result in the right time. Not only that, today we are moving from the traditional genomics where it answered only to up to 80%, however, 20% of the cases cannot be solved. Therefore, we are moving to multi-omics, epigenomics, transcriptomics, and metabolomics. With the previous data, we managed to introduce a new field, which is the pharmacogenomics, choosing the right drug to the right patient at the right time with the right dose. So now imagine this massive data, how it can be utilized and analyzed. With the AI, now we have the ability to manage and analyze this kind of data. Not only that, today the AI can be used for a new field called metagenomics and microbiome to do the analysis. And if I grab your attention, 5 years ago when the COVID-19 crisis hit the community, the first thing scientists did to conduct the whole sequencing for the virus, and we understand the mode of transmission for the virus, and we use this kind of information, and we taught the artificial intelligence to discover the different pattern in Saudi Arabia for the COVID-19. And we successfully managed to do that, and we publish this in one of the respected journals. On the other hand, the artificial intelligence being used as a diagnostic tool in pathology or digital pathology departments. So we know the breast cancer, and it's globally the first result, the first line for women to die, and we know that accurate and timely diagnosis is very important to save women, and therefore we use this kind of knowledge, and we use artificial intelligence to read and diagnose the pathology slides. And as you can see, we reach up to 98 accuracy for the result compared to the human report. Not only that, but the artificial intelligence today is being used not only in the pathology department, but in the healthcare systems in different clinics, including remote and telemedicine, and in drug discovery, in helping clinical support, clinical decisions, and other important decisions in the healthcare. However, with all these advantages for the AI, we still have some challenges, and some of the privacy, including the patient consent issues, and who will govern the data, who will control the artificial intelligence. Our new generation, do they have to depend on the artificial intelligence, or they have to manage or make a balance between the artificial intelligence and use the traditional information? Here in Saudi Arabia, we invest a lot of money in the digital pathology, 1.5 billion, and we have to be proud that we have the largest virtual hospital in the world. based on the artificial intelligence, and the future for the artificial intelligence in medicine, not only here in the earth, but we go beyond the earth to the space. Today we have robot surgery that can be conducted using the artificial intelligence. Today we have the artificial intelligence for multi-omics, and today we have the AI doctors and moving to nanotechnology. Not only that, the future is coming soon where the smart AI mirror being introduced into a healthcare system, where you wake up in the morning, you stand up in front of the mirror, and the mirror can tell you about your health condition. And with that, I just want to thank the organizing committee and thank to the president of the Shagra University and all the team for their effort, and thank you for your attention.
شكرا سعادة الأستاذ الدكتور يوسف هوساوي على هذه المحاضرة الثرية.